Today, we are going to talk about something incredibly important. We are going to discuss the health of your heart and blood vessels. This system is known as your cardiovascular system. Think of it as the amazing delivery network inside your body. Your heart is the powerful pump at the center of it all. It works tirelessly every second of every day to push blood to all your organs and tissues. The blood vessels are the highways and roads for this delivery service. They carry oxygen and vital nutrients everywhere they need to go, keeping you alive and well. This entire network is crucial for your overall health and well-being. Cardiovascular diseases are a group of problems that affect this very system. They're not just one single illness. Instead, they are a collection of conditions that can harm your heart or your blood vessels. When we talk about these diseases, we are often referring to things like heart attacks or strokes. These events happen when the flow of blood is blocked. It is like a major traffic jam on one of those critical highways. When the blood cannot get through, the parts of your body that depend on it, like your brain or heart muscle, can get seriously damaged. Understanding this is the first step to protecting yourself. It is important to know that these conditions often develop slowly over many years. The problems can start silently without any obvious symptoms. One common issue is atherosclerosis. This is a big word for a simple problem. It means your arteries, the main blood highways, are becoming narrow and stiff. This happens because of a buildup of a fatty substance called plaque. Imagine a pipe slowly getting clogged over time. As the plaque builds up, it makes it harder for blood to flow freely through the arteries. This process can begin when you are young and get worse as you get older. The good news is that we know a lot about what causes these problems. More importantly, we know a lot about how to prevent them and how to treat them. You have more power over your heart health than you might think. By making smart choices and understanding the risks, you can help keep your heart strong for a very long time. This is not about fear. It is about empowerment. It is about giving you the knowledge you need to take control of your health. Your heart works hard for you, and learning how to take care of it is one of the best things you can do for yourself. Let's talk about the choices you make every single day. These daily habits have a huge impact on your heart's health. What you choose to eat is a major factor. A diet full of processed foods, unhealthy fats, and too much sugar can harm your arteries. These foods can contribute to the buildup of that dangerous plaque we talked about. On the other hand, a diet rich in fruits, vegetables, whole grains, and lean proteins can protect your heart. Think of it as choosing the right fuel for your body's engine. Good fuel helps it run smoothly for a long, long time. Physical activity, or the lack of it, is another critical piece of the puzzle. Your heart is a muscle, and just like any other muscle, it needs exercise to stay strong. When you are regularly active, your heart gets better at pumping blood throughout your body. Exercise also helps you maintain a healthy weight and can lower your blood pressure. You do not need to become a marathon runner overnight. Simple activities like brisk walking, swimming, or even dancing can make a big difference. The key is to get your body moving consistently and make it a regular part of your routine. We must also discuss smoking. There is no way to sugarcoat this. Smoking is one of the worst things you can do for your heart. The chemicals in tobacco smoke can directly damage the lining of your arteries. This makes them much more susceptible to plaque buildup. Smoking also makes your blood thicker and more likely to form clots, which can lead to a heart attack or stroke. Quitting smoking is the single most effective lifestyle change you can make to improve your cardiovascular health. The benefits start almost immediately after you stop smoking for good. Finally, we should consider alcohol consumption. While some studies have suggested that very moderate drinking might have some benefits, heavy drinking is definitely harmful. Drinking too much alcohol can raise your blood pressure to dangerous levels. It can also lead to an irregular heartbeat and contribute to weight gain, which puts extra strain on your heart. If you do choose to drink, it is very important to do so in moderation. For your heart's sake, being mindful of your alcohol intake is a very wise decision. These lifestyle factors are all within your control, giving you the power to protect your heart. Beyond your daily habits, there are specific medical conditions that can quietly increase your risk for heart disease. One of the most common is high blood pressure, also called hypertension. Think of blood pressure as the force of blood pushing against the walls of your arteries. When this pressure is consistently too high, it puts a great deal of strain on your heart and your blood vessels. It forces your heart to work much harder than it should. Over time, this constant strain can damage the artery walls, making them weaker and more prone to the plaque buildup that causes heart problems. Another important factor is your cholesterol level. Cholesterol is a waxy substance found in your blood. Your body needs some cholesterol to build healthy cells, but having too much can be a problem. There are different types, but a high level of LDL cholesterol, often called bad cholesterol, is a major concern. This type of cholesterol is the main ingredient in the plaque that clogs arteries. Having high cholesterol often has no symptoms, which is why it is so important to get it checked by your doctor. Managing your cholesterol is a key step in keeping your arteries clear and open. Diabetes is another condition that is closely linked to heart disease. When you have diabetes, your body has trouble controlling the amount of sugar in your blood. High blood sugar levels over a long period can damage your blood vessels and the nerves that control your heart. This damage makes it much easier for atherosclerosis to develop. People with diabetes are at a much higher risk of developing heart disease, and often at a younger age. Controlling blood sugar through diet, exercise, and medication is absolutely essential for protecting the heart. Finally, we need to acknowledge factors that are not always within our control. Your genetic makeup can play a role. If your close relatives had heart disease early in life, your own risk might be higher. Age is another factor, as the risk for heart disease increases as we get older. Your gender can also matter, as men generally face a higher risk at a younger age than women do. Chronic stress and a lack of quality sleep are also now understood to be significant contributors. They can raise your blood pressure and lead to unhealthy habits, creating a vicious cycle that harms your heart. When lifestyle changes are not enough to protect your heart, your doctor has many effective treatments available. The first line of defense is often medication. There are many different types of medicines that can help manage the risks of cardiovascular disease. For example, doctors can prescribe drugs to lower high blood pressure or to reduce high cholesterol. There are also medications called blood thinners, which make it harder for dangerous blood clots to form inside your vessels. These medicines are safe and have been proven to significantly lower the risk of having a heart attack or stroke for many people. These medications work in different ways to protect you. Blood pressure medicines might help relax your blood vessels, making it easier for blood to flow through. Cholesterol-lowering drugs like statins work by reducing the amount of bad LDL cholesterol your body produces. This directly tackles the problem of plaque buildup in your arteries. For people with diabetes, controlling blood sugar with medication is also a form of heart treatment. The goal of all these medicines is to control the underlying conditions that put stress on your cardiovascular system and lead to serious problems down the road. In more serious cases, when an artery is already severely blocked, a medical procedure might be necessary. One common procedure is called an angioplasty. During this procedure, a doctor guides a very thin tube with a tiny balloon on the end into the blocked artery. Once in place, the balloon is inflated. This pushes the plaque against the artery wall, widening the passage so blood can flow through again. Often the doctor will also place a small mesh tube called a stent inside the artery. The stent acts like a scaffold to help keep the artery open long term. For very severe blockages in multiple arteries, doctors may recommend bypass surgery. This is a more significant operation. The surgeon takes a healthy blood vessel from another part of your body, like your leg or chest. They then use this vessel to create a new path for blood to flow around the blockage. It is like building a detour or a bypass on a highway to get around a major roadblock. While it is a major surgery, it can be life-saving for people with advanced heart disease. It restores proper blood flow to the heart muscle, relieving symptoms and preventing future heart attacks. Many people are curious about supplements for heart health. Some supplements may offer benefits when used correctly. For example, omega-3 fatty acids, which are found in fish oil, are well known for their potential to help. They may help lower triglycerides, which are a type of fat in your blood. They might also help reduce inflammation and lower blood pressure slightly. Another supplement is coenzyme Q10 or CoQ10. This is an antioxidant that your body naturally produces, and it helps your cells produce energy. Some research suggests it could help with certain heart conditions, but more studies are needed. Fiber supplements like psyllium can also be helpful. Soluble fiber can help lower your bad LDL cholesterol levels by binding to it in your digestive system and removing it from your body. However, it is absolutely critical to approach supplements with caution. The supplement industry is not regulated in the same way as prescription drugs. This means the quality and purity can vary greatly between brands. Always speak with your doctor before starting any new supplement. They can interfere with your prescription medications or may not be safe for you, depending on your specific health conditions. Never replace prescribed medicine with a supplement. It is also important to understand a serious condition called congestive heart failure. This does not mean your heart has stopped working completely. It means your heart muscle has become weak and cannot pump blood as efficiently as it should. Think of it as a tired pump that is struggling to do its job. As a result, blood can back up, and fluid can build up in other parts of your body, like your lungs and legs. This can cause symptoms like shortness of breath and swelling. It is a chronic condition that requires careful medical management, but treatments can help people live longer, more comfortable lives. In closing, the message today is one of hope and empowerment. While cardiovascular disease is a serious issue, we now know more than ever about how to prevent and treat it. You have a tremendous amount of control. By adopting a healthy lifestyle, working with your doctor to manage medical risks, and using proven treatments when needed, you can protect your heart. It is never too late or too early to start making heart-healthy choices. Taking care of your heart is a lifelong journey, and every positive step you take makes a real difference for your future health and well-being.
Let's start by demystifying this condition. When you hear the term heart failure, it can sound incredibly frightening. It doesn't mean your heart has stopped working or is about to stop. Instead, think of it as your heart muscle not being able to pump blood as efficiently as it once did. It's like a pump that has lost some of its power. Your heart is a remarkable organ, working tirelessly every second of every day to send oxygen-rich blood to all parts of your body, from your brain down to your toes. When this pumping action weakens, your body doesn't get the full amount of blood and oxygen it needs to function at its best. This is the core of what we call congestive heart failure, or CHF. The word congestive is key here. Because the heart's pump is less effective, blood can back up in other areas of your body. Imagine a gentle flowing river that suddenly encounters a blockage. The water level rises behind the block. Similarly, fluid can build up, or congest, in various parts of your body. This most commonly happens in the lungs, which can make you feel short of breath. It can also cause fluid to collect in your legs, ankles, and feet, leading to swelling. This fluid buildup is a direct result of the heart's struggle to keep blood moving smoothly through the circulatory system, a vast network of vessels that your heart is in charge of. It's important to view this diagnosis not as a final verdict, but as a starting point. It's a sign that your heart needs more support. And the wonderful news is there are so many ways we can provide that support. Modern medicine has made incredible strides in managing heart failure. We have a whole toolkit of lifestyle adjustments, medications, and other treatments that can help strengthen your heart, reduce symptoms, and allow you to live a full and active life. Understanding your condition is the very first and most powerful step you can take towards reclaiming your health and well-being. It puts you back in the driver's seat. So let's reframe our thinking. Congestive heart failure is a chronic condition, much like diabetes or high blood pressure, that needs ongoing management. It's a journey, not a destination. By working closely with your healthcare team, you can learn how to listen to your body, understand its needs, and take proactive steps every single day to help your heart do its job. This journey is about empowering you with knowledge and tools so you can feel confident and in control. Your heart has been working hard for you your whole life. Now it's time to learn how to work with your heart. To truly manage heart failure, it helps to understand what might have caused it in the first place. This condition doesn't just appear out of nowhere. It's often the end result of other conditions that have damaged or overworked the heart muscle over a long period. Think of it like a car engine that's been running too hard for too long without proper maintenance. One of the most common culprits is coronary artery disease, or CAD. This is when the arteries that supply blood to your heart muscle become narrowed or blocked by fatty deposits. This starves the heart muscle of the oxygen it needs to pump strongly, causing it to weaken over time. Another major contributor is long-standing high blood pressure, or hypertension. When your blood pressure is consistently high, your heart has to work much harder to pump blood out into your arteries. It's like trying to push a door open against a strong wind. Over years, this extra strain can cause the heart muscle to become thicker and stiffer, eventually making it less efficient at pumping. Similarly, a past heart attack can lead to heart failure. A heart attack occurs when blood flow to a part of the heart is blocked, causing that section of heart muscle to die. This leaves behind a scarred, weakened area that can't contract properly, impairing the heart's overall pumping ability. Diabetes is another condition closely linked to heart failure. Over time, high blood sugar levels can damage blood vessels and nerves that control your heart. And people with diabetes are also more likely to have high blood pressure and coronary artery disease, which are both risk factors themselves. Other less common causes can also play a role. These include problems with the heart valves, which may not open or close properly, forcing the heart to work harder. Certain viral infections can inflame and weaken the heart muscle, a condition called myocarditis. Even some lifestyle factors like excessive alcohol consumption or the use of certain drugs can be toxic to the heart muscle. Understanding the root cause is incredibly useful because it helps your doctor tailor the best possible treatment plan for you. If high blood pressure is the main issue, then getting it under control is a top priority. If coronary artery disease is the culprit, treatments will focus on improving blood flow to the heart. It's a bit like being a detective. We look at the clues from your medical history to figure out the story of your heart. This knowledge empowers us to not only manage the symptoms of heart failure, but also to address the underlying problem that started it all, giving you the best chance for a healthier future. Your body has a remarkable way of sending you signals when something isn't quite right. With congestive heart failure, these signals often start subtly and can be easy to dismiss as just signs of getting older or being out of shape. One of the most common and earliest symptoms is shortness of breath, especially during physical activity. You might find yourself getting winded just by climbing a flight of stairs or carrying groceries, activities that didn't used to be a problem. As the condition progresses, you might even feel breathless while resting or lying down, sometimes waking you up at night with a feeling of needing to gasp for air. Another key sign to watch for is fluid retention, which we call edema. This is caused by that congestion we talked about. You might notice your shoes feeling tighter than usual or see swelling in your feet, ankles, and legs. Pressing a finger into the swollen area might leave a temporary indent. This fluid can also cause rapid weight gain. Gaining 2 or 3 pounds in a day or 5 pounds in a week could be a sign of fluid buildup, not actual fat. This is why your doctor will ask you to weigh yourself every morning. It's one of the best ways to monitor fluid levels in your body. Persistent coughing or wheezing is another symptom that can be mistaken for a cold or asthma. In heart failure, this is caused by fluid backing up into the lungs. The cough might be dry and hacking, or it might produce a white or pink-tinged phlegm. It often gets worse when you're lying flat. Feeling constantly tired or fatigued is also very common. When your body's cells aren't getting enough oxygen-rich blood, everything can feel like a huge effort. You might feel exhausted even after a full night's sleep, lacking the energy for your usual daily routines. Other signs can include a fast or irregular heartbeat, as your heart tries to compensate for its weakened state by beating faster. Some people experience a loss of appetite or a feeling of nausea because the digestive system is receiving less blood. You might also feel dizzy, confused, or have difficulty concentrating, as the brain isn't getting the optimal amount of oxygen it needs. Recognizing these symptoms is not about causing alarm, but about empowering you. When you know what to look for, you can communicate more effectively with your doctor and get the help you need sooner. Receiving a heart failure diagnosis can feel overwhelming, but I want you to see it as the beginning of a new, proactive approach to your health. We have a fantastic toolkit of treatments that work together to support your heart and improve your quality of life. The foundation of this toolkit is built on positive lifestyle changes. These are the powerful things you can do every single day. The most important is adopting a heart-healthy diet, which we'll explore more deeply later. It involves reducing your salt intake to prevent fluid retention, limiting unhealthy fats, and focusing on whole foods like fruits, vegetables, and lean proteins. It's about nourishing your body in the best way possible. Alongside diet, regular gentle physical activity is incredibly beneficial. This might sound counterintuitive. If the heart is weak, shouldn't you rest it? But appropriate exercise, as approved by your doctor, can actually strengthen your heart and improve circulation. This doesn't mean running a marathon. It could be a daily walk, gentle cycling, or water aerobics. The key is to start slowly and listen to your body. Other crucial lifestyle changes include quitting smoking, as it damages your blood vessels, and limiting or avoiding alcohol, which can be toxic to the heart muscle. Managing stress through practices like mindfulness, deep breathing, or hobbies you enjoy is also a vital piece of the puzzle. Of course, medication is a cornerstone of heart failure management. We have several classes of drugs that are incredibly effective. These medicines work in different ways to make your heart's job easier. Some relax your blood vessels to lower blood pressure, some slow your heart rate to give it more time to fill with blood, and others help your body get rid of excess fluid. We'll detail these in the next section, but it's vital to take them exactly as prescribed by your doctor. They are your heart's essential allies, working behind the scenes 24/7 to support its function and keep you feeling your best. For some people, lifestyle changes and medications may not be enough. In these cases, we have more advanced options. Devices like pacemakers or implantable cardioverter defibrillators, ICDs, can help regulate the heart's rhythm and protect against dangerous arrhythmias. In more advanced cases, a ventricular assist device, or VAD, which is a mechanical pump, can be implanted to help the heart circulate blood. In the most severe situations, a heart transplant may be considered. This toolkit, from daily dietary choices to advanced surgery, provides a comprehensive, multi-layered approach to give your heart the support it needs at every stage. Medications are one of the most powerful tools we have to manage heart failure, and understanding what you're taking and why is key to feeling in control. Think of these medicines as your personal support team, each with a specific job to help ease the workload on your heart. One of the most important groups is ACE inhibitors, or ARBs. These drugs work by relaxing your blood vessels, which lowers your blood pressure and makes it easier for your heart to pump blood throughout your body. They are a foundational treatment and have been shown to help people with heart failure live longer, healthier lives. Common side effects can include a dry cough or dizziness. Another vital group of medications is beta blockers. These work by slowing down your heart rate and reducing the force of its contractions slightly. This might sound like the opposite of what you want, but it's incredibly helpful. By slowing the heart, it gives the chambers more time to fill completely with blood between beats, which actually improves the efficiency of each pump. It also reduces the strain on the heart muscle and can protect it from the harmful effects of stress hormones like adrenaline. You will usually be started on a low dose that is gradually increased over time. Feeling a bit more tired initially is normal as your body adjusts. To tackle the fluid buildup that causes swelling and breathlessness, your doctor will likely prescribe diuretics, often called water pills. These medicines help your kidneys remove excess salt and water from your body through urination. This reduces the overall volume of fluid in your circulatory system, which lowers blood pressure and decreases congestion in your lungs and limbs. It's a very effective way to relieve symptoms quickly. Because they make you urinate more, it's best to take them in the morning. A key side effect can be changes in your body's potassium levels, so your doctor will monitor this with regular blood tests. Finally, there are newer classes of drugs that have shown amazing benefits. One is a combination drug called an ARNI, which is even more effective than an ACE inhibitor or ARB at relaxing blood vessels and reducing strain on the heart. Another exciting group is SGLT2 inhibitors. Originally developed for diabetes, these drugs have been found to be remarkably effective for heart failure, even in people without diabetes. They help reduce fluid retention and have protective effects on the heart and kidneys. Your doctor will carefully choose the right combination of these medications for your specific situation, creating a personalized prescription to give your heart the best possible support. What you eat every day has a direct and profound impact on your heart's health. Think of food as the fuel you provide your body, and for a heart that needs support, providing high-quality fuel is essential. The single most important dietary change for managing heart failure is reducing your sodium intake. Sodium, which is the main component of salt, makes your body hold on to extra fluid. This extra fluid increases blood volume, which raises blood pressure and forces your heart to work harder. It also directly contributes to the swelling in your legs and the congestion in your lungs. Your goal will likely be to consume less than 2,000 milligrams of sodium per day. To achieve this, you'll need to become a bit of a detective in the kitchen and at the supermarket. The biggest sources of sodium are often not from the salt shaker, but from processed and packaged foods. Things like canned soups, frozen dinners, cured meats like bacon and deli ham, salty snacks, and fast food are loaded with hidden sodium. Start reading food labels carefully. Look for options labeled low sodium or no salt added. Cooking more meals from scratch at home is the best way to control how much salt goes into your food. Instead of salt, get creative with flavor by using herbs, spices, garlic, onion, lemon juice, and vinegar. Your diet should be rich in foods that nourish your heart. Focus on eating plenty of fruits and vegetables, which are packed with vitamins, minerals, and antioxidants. Whole grains like oats, brown rice, and quinoa provide important fiber. Choose lean sources of protein such as skinless chicken, fish, especially fatty fish like salmon, which is high in heart-healthy omega-3 fatty acids, beans, and lentils. Healthy fats found in avocados, nuts, seeds, and olive oil are also beneficial. It's also important to limit saturated and trans fats found in red meat, butter, and processed baked goods, as these can contribute to artery-clogging plaque. Here is a simple idea of what a heart-friendly day of eating could look like. For breakfast, you might have a bowl of oatmeal made with water or low-fat milk, topped with fresh berries and a sprinkle of nuts. For lunch, a large salad filled with leafy greens, colorful vegetables, grilled chicken breast, and a light vinaigrette dressing. An afternoon snack could be an apple with a small handful of unsalted almonds. For dinner, you could enjoy a baked fillet of salmon with a side of steamed broccoli and a small portion of brown rice. By making these smart, delicious choices, you actively participate in your own care, reduce your symptoms, and give your heart the best possible fuel to thrive.